Hello, I'm Anoj, a surgeon in Adelaide, and I'm going to talk about hernias today. Do you know about a quarter of men will develop a hernia during their lifetime, but women carry a higher risk of complications from hernias? A hernia occurs when an internal organ pushes through muscle or connective tissue which is encapsulating it. Inguinal hernias are far more common, most common type, accounting for about 70%, 75% of the hernias. They occur in the groin area and far more common in men than women. This is due to natural weakness in that region due to the development of the male in fetus, where the testicles descend into the scrotum through that pathway. Hernia repair is one of the most commonest operations in Australia, with about 90,000 operations performed every year. How do you know if you have developed a hernia? Well, the telltale signs of a lump in the groin or the umbilicus would be the best way to diagnose a hernia. But you might notice sudden onset pain heralding an incarceration of the hernia, which is entrapment of tissue, either fat or intestines, in the hernia sac. This is a surgical emergency because with the entrapped organs or the fat will lose its blood supply and can die off. That's why you need to see your doctor as soon as you suspect that you have a hernia. They will organize scans and assess the risk of such complications. A hernia will not go away on its own. Some small hernias can be managed without surgery, but often they tend to get bigger as the muscle wall weakens further. Surgical repair is the only definitive way to fix a hernia. What options are available for hernia repair? We have open or laparoscopic, or we also call it keyhole methods available for the repair. While keyhole surgery is gives you smaller incisions, lesser post-operative pain, and quicker recovery, as well as being able to place a large mesh to cover the weakened area. It also has few inherent complications. Collection of blood or fluid in the previous place where the hernia was placed. Also, shoulder pain from gas we used for the procedure, urinary retention, and also damage to the blood vessels or the tubes that carry sperm into your scrotum are those complications that can happen. Open hernia has its own complications, higher wound infection rates, as well as chronic pain issues. What about the use of mesh? Before the widespread use of mesh, surgeons used to suture repair the hernia using the weakened tissue. Studies reported 25 to 50% recurrence rates with these methods. However, with the widespread use of mesh, the recurrence rate has come down to low single digits. Mesh has its own issues. Like any foreign implant, mesh can become infected. And mesh infection is a serious problem, requiring removal of the mesh in some cases. Chronic pain can be another problem caused by nerve damage during the surgery, or the mesh encroaching on nerves or surrounding connective tissue. However, the complications associated with mesh in inguinal hernia is totally different to mesh issues that were highlighted a few years back due to mesh use for prolapse or urinary incontinence, which also led to a class action. These meshes are implanted in very sensitive areas with a lot of nerves and result in higher rate of debilitating chronic pain. For vast majority of patients, the long-term benefits of preventing a recurrence far outweigh the real risks of mesh. Again, your surgeon will be able to discuss this with you and allow you to arrive at an informed decision. Your surgeon is there to help you navigate through the procedure and the recovery.